Well, let's see if I can finish this without ScreenPal stopping. So let me pause and get to the slide for part 5, which might be a record for a number of videos. This is a great summary slide. So for health-related fitness, which is to enhance longevity of life, we know that the recommended amount is 40 to 59% if using the heart rate reserve method. 5 to 7 days per week, accumulate 150 minutes per week. Now, this is moderate intensity physical activity if I want to enhance health. And this is 30 minutes most days or 5 to 7 days per week. First is physical fitness, which is a more volume or higher intensities. So if I want to enhance cardiovascular fitness, then it's 60 to 80% of heart rate reserve, 3 to 5 days per week, 20 to 60 minutes per session, and this also equates to about 3 miles 3 times per week. I ask a specific question about a runner, and so remember this 3 miles 3 times per week because it is one of the options whenever you are taking test 3. And then for performance can be 7 or more times per week. And it's usually at higher intensities, so greater than 80% of heart rate reserve. Most sessions are greater than 60 minutes per session, about 50 to 90 miles per week for runners that are looking at running performance. People have been working months and years to get to this place. So if you look at this as a continuum, there is areas in between these that people work for. So if you look at changes in percent VO2 max and then exercise capacity in METs, you know that for some people, 5 METs might be considered challenging. For some, it might be considered a little bit easier. So when we have different levels of fitness, we need to really know somebody's max and what percentage of max, say, a 5 MET bout is. So not all exercise is the same for everyone. Let me talk to you about some other considerations when prescribing exercise, especially in Charleston, since we have such a hot and humid environment. If you're beginning an exercise program or you're working with a client, it takes the body between 7 and 14 days to acclimate to heat and humidity. So if we have a cold spell, which would be a miracle, and then in the spring it starts to get warm, it takes the body time to get used to that. And since the primary method to dissipate heat when exercising is evaporation, that relies on blood flow. Well, so does VO2, so does cardiorespiratory fitness, so does aerobic physical activity. So the two compete. So it's really important to cut back when it's hot and humid and give the body time to react and to adapt to these changes. There's more details on this in your book, and this is something that we cover in more detail in exercise physiology, but I did want to mention that. On the other extreme, if you're in a cold environment, we know that if the wet bulb globe temperature is 50 degrees or below, then you can actually run the risk of hypothermia, which can also create some challenges for the body. How about altitude? Well, if you study abroad or if you travel and you're going to exercise at higher altitudes, then you're going to have a higher heart rate when doing work that's similar to what you would be doing at lower altitudes because the pressure gradient is different. So you're going to rely on a greater cardiac output to deliver the same amount of oxygen. Okay. Also, too, at higher altitudes, you're going to be able, one positive is you're going to be able to regulate core temperature a little bit better if it is warmer because the air is usually drier or cooler. So that pressure gradient is a little bit different. When should exercise programs be supervised? Recall from Unit 1, if you have a beginning exerciser with diabetes, the program should be supervised because of challenges with blood or potential challenges with blood glucose. That person might need a little bit of help. If you have somebody that's hypertensive, if you have somebody with coronary heart disease, or if you have somebody that has asthma, they're going to need to be in a supervised program. Well, are there cases where unsupervised? Well, if you have a beginner who smokes, they can begin in an unsupervised program. And then older individuals who pass pre-screening, so people above 65, 67 years old, if they've passed their pre-exercise screening, then they can exercise in an unsupervised environment. Now, remember, when prescribing exercise, that 5 METs is not the same for all individuals. So although these people may be in an unsupervised program, their overall workload might be lower than others. So I'm going to put these questions for you on a PowerPoint. I'm not going to read each slide, but I've worked through the solution on each slide for you. I'm also going to do these in the individual training program, but this is a way for you to ask yourself a question and then see if you have retained or if you know how to apply this information. Again, I'll show you an example of this when I go over the individual training program, which my plan is to do that. But I at least wanted, this is something that I worked through in class, so I at least wanted you to have it so that you could work through it on your own. And then when you're working through these, if you have questions, just email me and let me know, and I'll be more than glad to help you. But I've given you step by step on how to do these. This is something that you'll need to do for your individual training program. So make sure you walk through these. Use your book as a resource. Use the previous slides as a resource. So this is the last part of the cardiorespiratory fitness. There won't be a lecture on body composition. There won't be questions on exercise prescription for body composition, given the shortened week and the individual training program. For test 3, it'll just be on the content that I covered along with chapter 11 on exercise prescription for cardiorespiratory fitness. If you have questions or if there's anything I can do to enhance your educational journey, please let me know.